Hey everyone, in this video I'm going to kind of go over my take on manual therapy techniques. And so I am a certified orthopedic manual therapist. Actually, I have several certifications of manual therapy from several different companies and organizations. And so I am a manual therapy fan. However, I'm also a huge fan of strengthening exercises, home programs, some pain science education. There's a lot of different aspects. I don't necessarily have one favorite over the other. I utilize manual therapy in my clinic, and my staff utilizes manual therapy in my clinic to just further enhance the patient experience and to hopefully gain better outcomes. Now I know some people say I don't want to use any manual therapy. I'm only doing exercises, strength training, and functional training or whatever. And then you'll have someone else that's only manual therapy or modalities based. And you have other folks, maybe they're only pain science education. They're just going to maybe talk with the patient, go through things, and all those things are fine. And again, I don't judge anyone for doing any one of those things. I think a combination of all of them for me works really well and has for a long time. So for me, there are maybe some biomechanical things, some orthokinematics, some histology stuff that goes on when you're doing some manual therapy. But for me, I use it more for number one, to kind of enhance my patient experience, because a lot of times a patient wants to have something done to them, right? They want to have hands-on, that connection hands-on. I think they like that, sometimes better than just strictly exercise. You're just kind of cueing them or prescribing certain exercises or whatever. And although there are those people out there that do just like to have the exercise, they don't want to be touched, or they don't want to, have the manual therapy done, and that's fine too. But I think a combination of both, especially from a patient that's looking for that hands-on approach, for me works really well. And so we'll go through maybe it's massage or some sort of soft tissue work. Maybe it's joint mobilization, or maybe it's a manipulation, again, depending on your scope of practice, if you can do those things. Cupping techniques, scraping, all those kind of things, can all be, I think, beneficial if used correctly, and especially if you're telling the patient why you're doing it, right? Like, I don't tell a patient that I'm performing a joint mobilization because I believe, and I'm not saying that it's wrong and other people can believe what they want, but that I believe that I'm, realigning joints, or I'm going to aggressively kind of beat the fire out of you with this, scraping tool or whatever, or a cupping tool until the person bleeds and they're all bruised up. So I don't do any of those kind of things. And I definitely don't tell them that I'm doing it because I feel like that's necessary for me. Now, some patients, love to have that done. They feel like they really got benefit from that, and that's perfectly fine, and if they're okay with that and the clinician's good with that. And again, everybody's approach is different. So I'm not saying mine is right. This is just kind of explaining how I do it, because people do ask. So I go at it more from the aspect of I'm improving kinesthetic awareness with my maybe scraping or soft tissue work or joint mobilization, or maybe I'm modulating tone or modulating pain and trying to decrease some of this apprehension to movement and sensitivity to movement. And so I'll do those things, and the patient's able to move and go through their program. Or maybe if they go through their program and they do these exercises, these movements that I want them to do, even though they're uncomfortable, at the end, they're going to get massage or soft tissue work or modalities or whatever that is, to try to help. So I can use it, or I use it for several different purposes, either almost like a bargaining chip in a way, or I would use it, in conjunction with things that I'm doing to actually have some sort of, change at the time. And so I don't think there's any right or wrong way with it, because again, I use it all the time. I teach it to students. I have courses that I teach. I teach the manual therapy techniques. And again, for me, it's not so much like you have to push exactly this way and that way and all that. And I'm not saying that's wrong. And I learned all of that. Just for me, it's just simpler just to go through just a global understanding of what you're doing, and then just kind of use those approaches and techniques, with what you're doing. So again, I think manual therapy has its place. I like it. I use it. And so at the end of the day, I tell my students that I've had come through, and my staff, and I would tell the patients, if it gets you better and it gets you back to the things you want to do, then, and it's not harming you, I don't think there's anything wrong with it. You definitely use it, in your practice. So again, that's my thought on manual therapy. I will be doing kind of some videos, almost like a series maybe, of different manual therapy techniques, just different things that I like, little tips and things that I like, maybe products that I use for different manual therapy techniques, and then I'll provide maybe some links and things like that to where you can get some of those products. So, because I was asked also to if I would do some of those things as well, so I'll definitely be doing that. So be sure to check those videos out coming up. So again, thanks so much. Make sure that you hit that subscribe button, like, leave a comment. I appreciate you guys all so much. And until next time.